iglesias. I'm going to perform a Leopold's maneuver. So Leopold's maneuver is used systemically palpate the gravid uterus, and it is easy to perform non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. Leopold's maneuver is done after 36 weeks of gestations. It helps the expectant mother and the healthcare provider to be better prepared for the labor. And it is also help determining if it is much safer to perform a cesarean section. Prior to conduct the procedure, I prepared the necessary equipment, which is the towel, pillow, and also the stethoscope. Next is I have to perform the hand washing to protect my patients and myself as well from the infection and the cross-contamination. Good morning, ma'am. I'm Mayan Iglesias. I'm your student nurse for today. May I know your stand, please? Please do state your name and birthday.
Generous Tuntawe, March 14, 1990.
Okay, thank you. How would you like me to call you, ma'am?
Ma'am Jenny.
Okay, Ma'am Jenny. We're going to do a Leopold's maneuver that can determine the positions of your baby inside your uterus. Ma'am Jenny, it would be fine for you that I'm going to close the door, that no one can disturb us while performing the Leopold's maneuver. Okay. So, okay, ma'am, before we begin, I encourage you to avoid first that you might not feel uncomfortable later. An empty bladder promotes comfort and allows more productive examinations. On the other hand, the distended bladder may observe the fetal contour and slightly deviated the uterus.
Okay, ma'am, you're back. You're done voiding. I need you to lie down and slightly flex your knee, and I needed you to turn to your side a little so that I can place a towel underneath your hip. Position your patient supine with one pillow under her head, and a flexed knee will relieve the tension in the abdominal musculature, and placing a towel beneath the patient's hip will displace the uterus off of the inferior vena cava and the aorta, thus preventing supine hypotensive
So
syndrome.
now we're going to begin, and I'll need to expose your abdomen, ma'am.
Okay, to begin with the procedure, expose only the area of the examination, and if right-handed, stand of the patient's right side.
So now I'm going to proceed with the first maneuver, which is called the condyle grip. Now face the patients and palpate the uterine fundus if what part of the baby is in the upper uterus.
It may be the fetal head or the bridge. The fetal head feels round, hard, freely movable, and bloatable, while ridge feels softer and nodular.
So now I'm going to proceed with the second maneuver, which is called the umbilical grip.
What I'm going to do is to palpate downwards on the lateral uterine surface and determine the fetal back or fetal extremities. Okay, apply a gently but deep pressure.
So now I'm going to proceed with the third maneuver, which is the Polix grip.
To do this, I'm going to place my hands over the symphysis fuel. This grabs the lower uterine segment with my thumb and fingers and determine if engagement has already occurred.
Proceed with the fourth maneuver, which is called pelvic grip.
This is done to determine the findings of third maneuver as well as determine the presenting part that is in the hypogastrium of the mother. Also determine the cephalic prominence. So if prominence is at the same side as of the fetal extremities, then the head is flexed. But if the prominence is off the same side as of the back, then the head is extended.
Now that we are done performing the Leopold's maneuver, so now let's locate the fetal heart tone and listen it for at least 1 minute. Okay, ma'am, I'm done with the procedure. I'm going to cover you up now. And ma'am, are you feeling comfortable?
Yes.
Okay, ma'am, thank you.
I have determined that your baby is at your right side and that your baby is in cephalic position, which means the head of the baby is at the lower part of your uterus and it is already engaged. This is an ideal position of the baby for labor.
So after doing those procedures, let's proceed now to the hand washing and to determine the findings, and let's have a documentation.